As a historian yourself, you bring up history. You know how historically difficult health care has been, and your time as Speaker of the House and beyond. This week, of course, we're starting to see those fissures emerging. We're seeing the Vice President going out and meeting in different states to try to sell this new health care law. And we're hearing from Sarah Palin this morning in an interview on Breitbart News. I'm going to read to you what she said about this and get your reaction. She said, "Remember, this is government-controlled health care, the system that requires enrollment in an unaffordable, unsustainable, unwanted, unconstitutional continuation of government-run medicine. And even in this new quasi-reformed proposal, there is still an aspect of socialism. That's the whole premise here." So there's a real battle here. She's calling it socialism. Are we going to hear more of that?
Well, I'm sure you are. Look, I think the hard right would like to have purity or nothing. The fact is we're in a total mess. The health system's been decaying now for a very long time, getting steadily worse, and more bureaucracy, more government, more controls, and for that matter, more insurance company bureaucracy. I think that this is a step, and we ought to be clear, this is not the final game. We're going to get a bill, I think. It won't be quite what they introduced. It'll go through a process of reform. And frankly, Vice President Pence has been perfect about this. He served in the House. He was chairman of the House Republican Conference. He served as governor. Before that, he was a state legislator. He gets all this. You start somewhere. And Paul Ryan introduced a bill and came out of the Ways and Means Committee and the Energy and Commerce Committee with 0 Republican opponents. Remember that. Now they're going to have to amend it and work on it. Then they got to go to the Senate, which will be very different. Then they'll go to conference, and we'll have the first step. But Dr. Price, as Secretary of HHS, is going to have many, many more steps to get us where we want to go over the next 3 or 4 years.
Yeah, and the problem, though, the longer that this takes, the longer it's going to take to get any other big things done, like tax reform. I mean, you know, this is, though, I think, a good example for President Trump early on in his presidency to see, though, how complicated things can be on Capitol Hill to get anything done to negotiate. You know this very well, Speaker. What advice do you have for President Trump? Because a big pitch in his campaign was, I make deals, I can get things done, I can work with Congress. What advice do you have for him to get health care done, to bring Republicans and Democrats to the table that really aren't in agreement right now?
Well, my advice is to remember there are 435 House members. There are 100 senators. Most of them are not directly involved in a health bill. Start working right now on a bipartisan basis on an infrastructure bill. Bring in Democrats. I'd ask every House and Senate member in both parties, what do you need in infrastructure in your district to be competitive in the world market, to create jobs, and to help your folks get to work and have a decent future? I'd start that right now. I would start the tax bills right now. The fact that in the Senate you're going to bring the tax bill up second because of the nature of Senate rules is fine. These things can all be moving in parallel. You don't have to do one and then another and then another. In fact, it's dangerous to get fixated on one item. So I would not, I mean, my advice to them would be move 3 or 4 or 5 things. When I was Speaker, we were doing welfare reform, balancing the budget, reforming the Food and Drug Administration, reforming telecommunications, strengthening intelligence, all simultaneously. We were not doing them one by one.